So now let's look at some case studies of leveraging COVID investments for hepatitis elimination. And we're going to first hear from Dr. Nida Ali, who is a physician in Pakistan. She completed her fellowship in global health at Emory University. She assisted the Division of Viral Hepatitis at CDC in work on hepatitis B vaccine. And she spent time with us here in Atlanta at the headquarters of the coalition, and is now a coalition global hepatitis elimination fellow in her native country of Pakistan. And I'll turn it over to Nida. Nida?
Can you see my screen, the slideshow?
You go to slideshow.
Yes, but not in presentation mode.
Okay.
Just go over the slideshow there at the top.
Yeah.
To the right. Okay. Go up. Slightly to the right.
Okay, let me share that once again. Yeah. Do you see the correct view now?
Yes, good. Go ahead, please.
All right. So thank you for the introduction, John. I'm working as a Hepatitis Elimination Research and Outreach Fellow in Pakistan, and currently leading this project, LHEAP, Local Hepatitis Elimination and Prevention. Now, most of us already are aware that Pakistan is the highest burden country in the world in terms of the number of patients living with hepatitis C. And that means just because of hepatitis C related related cause, we have one death every 20 minutes, which means that every hour we have at least 3 people dying of hepatitis C. On June 3rd, 2023, there was this MOU that was signed between Coalition for Global Hepatitis Elimination and Ministry of Primary and Secondary Healthcare, Punjab. And through this, we initiated this LEAP project, which is basically an implementation research project through which we aim to eliminate hepatitis in a particular geographic area with a catchment population of 100,000. And the first phase of this implementation is already in progress. And in subsequent slides, I will be showing what work has been done so far. So these services that have been listed here are being provided at the doorstep, which includes screening, viral load testing, hepatitis C treatment, care and follow-up, and linkage to care for hepatitis B, provision of birth dose and adult vaccination, and follow-up testing for checking the sustained virologic response. These are some of the media coverages from signing of the MOU that day in June. And so far, starting from July 10th up till August 28th, these are the numbers that we have tested. It's about 20,000, and the prevalence on rapid test for hepatitis B has been less than 1%, and for C has been 1.6%. Now, these numbers may seem low, but let me reiterate the fact that we have been testing children of all age group. We have been testing all age groups, regardless of the age, from a child who is 1 day old up to the maximum age that we have in the field, which is in our data, a 95-year-old. So these numbers may seem diluted, but this is the first study of its kind where we have included all age groups. And for PCR prevalence of hepatitis B, again, it's less than 1%, and for hepatitis C is also less than 1%, but the numbers are still big. And our teams have also vaccinated more than 5,000 individuals, and these 5,000 people are all over the age of 18, because in our cohort, most of the under 18 people are vaccinated through EPI program in their childhood. This is the case study that actually tells us how we use the resource from a COVID pandemic that was about to be wasted and utilized it for hepatitis elimination in our LEAP project. So this district health authority had hired 32 COVID vaccinators that was on top of the already available EPI vaccination staff that was present there. So with the help of these workers, there were 4 million people who were vaccinated in Rawalpindi district. Rawalpindi is a district in Pakistan, a large metropolitan city that has population of about 6 million. So the drive was really fast in the initial days of the pandemic, and it led to, of course, vaccination of 4 million people in this one district. But now the COVID-19 is actually waning off the global health scenario, and we are, just like John mentioned, we are at the risk of losing all these capacities, all those trained HR and testing capacity. So what we wanted to do was to sustain this capacity and use that for hepatitis elimination. So we hired these 32 COVID vaccinators as frontline hepatitis elimination workers, and they have all the skills that we needed, including vaccination, rapid diagnostic testing, drawing the blood samples, which one of our workers is doing in the field with this child, and yeah, all the other surveillance related tasks. So now, because we have done the special training for them and trained them not just for vaccination, but also for other surveillance related services, I want to mention that these workers are skilled in door-to-door surveillance of any kind of infection that may include airborne, waterborne, vector-borne, or bloodborne. And they are skilled at contact tracing, again, rapid testing, blood sampling, vaccination, data recording, and social mobilization. So imagine we have this staff that was about to be jobless, and now they have this capacity that they can be used as frontline pandemic response staff in case of any pandemic that hits, regardless of the route of transmission. The other thing was the lab that was established in Rawalpindi during the days of COVID. Initially, this was the lab that was established in 2009 for hepatitis B and hepatitis C PCR. And then in 2019, before the first case of COVID arose in our country, the lab was repurposed and sort of upgraded to BSL-3 grade for testing of COVID-19 PCRs at that point. So from late 2019 up till now, there have been more than 600,000 COVID PCRs done in that particular lab. But again, because the COVID-19 was waning off, this capacity was being lost. And the first visit that I did in this lab, what we saw was that there were a lot of kits and reagents of COVID testing that were filled up to the top in the refrigerators, but they were expired. So there was this huge capacity, but that was not being used. Similarly, the machines, they were not being maintained, and the staff that was hired, they were there, but literally not doing any testing like for weeks. So what we did was converted this particular lab into back into hepatitis B and hepatitis C PCR lab. We just had to invest very minimal resources. For example, the machines were the same. We only had to spend very minimal resources for buying PCR testing kits and reagents. And since the LEAP project has started, we have done more 284 PCR tests in that lab. So what this means is that there was this capacity where we could leverage COVID-19 investments to accelerate the fight against hepatitis elimination. Well, this is a very small portion, a very small project, and a very small number of patients, but it's still working. And when I look at other districts in Pakistan, there have been similar things going on in other districts. They are laying off COVID staff, and they have these fancy COVID labs that are underutilized. So there is this huge window of opportunity where we can use the same pilot and actually utilize these resources for good. And now that we have this infrastructure of a lab and skilled person, the LEAP project is actually really ready to respond to any kind of pandemic that hits with all the resources that we have. Thank you. That was it. Open for questions.
Very good. Thank you.